Hi, this is November's back care stroke mat YouTube upload. We'll start with our focus on breath. We'll take ourselves down onto lying. Supine position, pelvis in neutral, so bones at the front of the pelvis flat and level. Collarbones long, arms pressed down, gentle lumbar curve. And then we'll focus on the ribs. So placing our hands onto the ribs, we want a soft breath in, and as we do so, we engage the deep pelvic floor and the transverse. We feel the rib cage expand. Breathing out, rib cage recoils. Keep the connection. Breathing in, expanding the ribs, and breathing out, recoiling. So we're really trying to fill the lungs up when we breathe. And I want you to see if you can take the breath into the back and through to the sides of your lungs so that the rib cage expands laterally. The abdominal wall stays relatively flat. You will get a soft drop down of your diaphragm into the abdominal cavity. But because we're drawing those core muscles in, the actual belly itself is going to stay nice and still. One more cycle of breath. Now we'll focus on the fast twitch fibres of our pelvic floor next. This is important that we do not squeeze our buttocks. Our pelvic floor muscles are deep inside us. We want a maximal contraction, and we're trying to make that muscle group contract as fast as possible. I want you to imagine this is like a light switch being turned on and then turned off again. So with focus to the pelvic floor, contract, release, contract, release, contract, release, contract, release. Buttocks staying relaxed as we contract and release, contract, release. We'll do 4 more repetitions. Contract, release, contract, release, contract, release, and last time, contract and release. Now those maximal contractions will help to strengthen up our fast twitch fibres, which will kick in response to sudden changes of pressure, such as when we cough, sneeze, jump and laugh, hopefully keeping ourselves continent. Let's focus back onto the core, contracting at a low level now. So deep pelvic floor and transverse, roughly about 30% of the level that they could contract at, while we perform pelvic tilts. Just gently pressing our lower back to the floor and releasing. If you think of your pelvis like a wheel, you're rolling the wheel towards you and then rolling the wheel away from you as you work the pelvic tilt. We'll get a little bit of knock-on movement into the hip joint as well, and we'll feel that the femur, thigh bones, will be moving slightly as we perform pelvic tilt. That's absolutely perfectly normal and should be happening. Making these our last 2 pelvic tilts. And then final one, bringing pelvis to neutral, so the 3 bones at the front of the pelvis, the pubis and the hip bones, are flat and level to each other. Now we want to keep the pelvis still and maintain the spine in neutral when we move our leg. The exercise will be hip release. So if we take a soft breath in to engage our core, as we exhale, we let the knee gently lengthen to the side and slide the leg down the mat. Inhaling, rotating the leg to the parallel and sliding back up. So we've got a knee drop out, followed by a heel slide in lateral rotation. We bring the leg back to the parallel and slide it back up. Exhale out and inhale up. Exhale out. Inhale up, reversing it. So start the movement with heel slide. Rotate it out. And knee drop brings it back in. We'll go for 2 more repetitions. And final one. Changing legs. So we'll use knee drop followed by heel slide, rotating to parallel and sliding back up. keeping the pelvis and the lumbar spine neutral in response to the movement of the leg, by maintaining that soft connection of the core muscles. Final time through before we reverse the movement. So we start with heel slide, rotate the leg out, slide it back up, knee drop brings it back in. Heel slide, rotate out, slide it back up, knee drop brings it in. Last time through. Now let's glue the legs together. Take the arms out slightly and keep your shoulder blades and your head in contact with the floor. Rotating the pelvis, knees, soles of the feet off to one side and back to the centre. And then through to the opposite side and back to the centre. So those 3 points of contact at the upper body, base of the skull, so the back of your head and your 2 shoulder blades. Keep those 3 points of contact as you work your rotations, at the same time as trying to maintain that soft connection, deep pelvic floor, transverse. Careful not to let the knees either slide off each other or separate away from each other. Working one more repetition in each direction before releasing. Now we are going to move on to our side next to practice some rotations, and the focus of our rotations for November will be to pull the arm into the shoulder socket and to let the arm drop down, okay? So we'll be working a long arm spine rotation. We'll set up as we have done with the right angle at the hip joint, knee joint, spine in neutral, head on the pad and the arms long. So we're going to take a breath in, engaging our core muscles, reaching to the ceiling, and then this is where we want to draw the arm into the shoulder joint. So a nice thunk to bring the arm down. Breath out to rotate. Holding for 3 cycles of breath. Breathe in. Breathe out. Breathe in. Use the out breath to return. Breath in, engaging the core, reaching, and then let the arm drop into the shoulder joint. Breath out, rotate. Holding 3 breaths. Breathe in, stay. Breathe out, stay. That nice deep thoracic breath. Breathing laterally. Breathe in and breath out, release. Engaging the core, reaching, shoulder into the joint and rotating. 3 breaths. Exhale to close. Engage and reach, shoulder into the joint, rotate. 3 breaths. Out breath to return. We'll work 2 more cycles of rotations, breathing in to engage and reach. Draw the arm into the shoulder joint, breath out to rotate. Breathe in, stay. Breathe out, stay. Breathe in, stay. And breath out to close. Last one. Breath in, engaging our core, reaching. Arm into the shoulder joint, breath out to rotate. Breathe in, hold. Breathe out, hold. Breathe in, hold. And breath out to return. Now we're going to work pelvic floor again. This time we're going to try an exercise known as the pelvic elevator. So we are going to try to engage our core muscles about 1/3 of their capacity. So the elevator goes up to floor 1, and then by another 1/3, so the elevator goes to floor 2, and then by our final 1/3, so we're right at the top floor with our pelvic floor. So in terms of the depth of contraction, we're contracting a little bit, a bit more, and then maximally. Once we get to the top floor, we'll try to reverse it to come down through the floors. But please do not worry if you get to the top floor and you relax a little bit, but all ready, find that you're actually on the ground floor or even in the basement when you try to relax a little bit more. This is one of those exercises that takes quite a lot of practice to actually get the release of the pelvic floor. So it's easier for the lift to go up and it's much harder for the lift to come down. So with focus on our pelvic floor, again, without clenching our buttocks, we'll engage a little bit like a lift coming up to the first floor and we hold it. And then we engage a little bit more like the lift coming up to the second floor and we hold it. And then we engage our pelvic floor maximally like a lift coming up to the top floor and we hold it. We're going to try to let go just by a little bit to come back to the second floor and hold. Let go a little bit more, come back to the first floor and hold. And then a final release to the ground floor. Let's practice that again. Engage pelvic floor, coming up in the lift to floor 1 where we hold. A little bit more with pelvic floor, so we're up to floor 2. And then maximum contraction pelvic floor right up to the top floor, holding. Try to let go a little bit to floor 2, hold. Release a little bit more to floor 1, hold. And then a full release to the ground floor. We'll try that elevator exercise one more time. So we engage pelvic floor, coming up to floor 1 and hold. A little bit more with the pelvic floor to floor 2 and hold. And then our maximal contraction to floor 3 and hold. Letting go a little bit to floor 2 and hold. Let go a little bit to floor 1 and hold. And now complete release down to the ground floor. Lovely work. We're moving to cat stretch next. So we'll come on to hands and knees. Take a breath in to prepare, engaging pelvic floor transverse. Breath out, flex the spine. Breath in, extend the spine. Exhale, flex. Inhale, extend. Working another 4 cycles of cat stretch. And 3. Last 2. And last 1. Okay, let's do spinal rotations, lying on our side. I'm going to flip head and heels round. Same focus of pulling that arm into the shoulder joint. So we're side lying in neutral. We take a nice deep breath in, engaging our core, reach to the ceiling and pull the arm into the shoulder joint. Breath out to rotate. Holding breath in. Breath out. Breath in. And exhale to return. Breath in, engage the core and reach. Arm into the shoulder joint. Breath out to rotate. Holding breath in. Breath out. Breath in. And exhale, return. Engaging the core, reaching and rotating. Holding breath in. Breath out. Breath in. Breath out to return. We've got 2 more cycles of rotations to go. Breath in, engage the core, reach. Arm into the shoulder joint. Breath out, rotate. Breath in, stay. Breath out, stay. Breath in, stay. Breath out to close. And last time, breath in, engage the core, reach, draw the arm into the joint, breath out to rotate. Breath in, stay. Breath out, stay. Breath in, stay. And breath out to close. Okay, we're going to work on strength of pelvic floor next. So from our side lying position, Our aim will be to contract the pelvic floor maximally and to maintain the maximal contraction for 10 seconds, okay? So with focus to pelvic floor, we draw up maximally holding 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, let it go. Now we'll do this a total of 3 times. So second set, draw up maximally, holding 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, releasing. And then our third and final cycle of pelvic floor, maximal contraction, holding it there at its maximum for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release it. We'll move on to bridge next. And if you've got a cushion or a pad that you worked with underneath your head, we can pop that between our knees to give us a little bit of inner thigh activation. So from our supine position, we take a breath in, engaging the pelvic floor under transverse abdominals gently. On the breath out, and to articulate the spine segment by segment off the mat to the straight line of the bridge. Breath in, we reverse, we roll back down. Our out breath peels us up. Our in breath peels it down. We're aiming here to press every segment of our spine into the mat on the way up and also on the way back down. I'd also like you to try to keep your hands and your arms pressed flat to the floor while you're bridging, at the same time as maintaining 3-point balance through your feet. So you're holding your weight evenly through the foot at the base of the big toe, the base of the little toe, and the centre of your heel. We'll make this the last time we roll into and out of our bridge. Before moving to seated, where we'll practice shoulder girdle mobilisation. You can kneel as well if you prefer. We'll start with elevation depression of shoulder girdle. So we'll breathe in, lift the shoulders towards the ears, and breathe out, release them down the back. Breathe in, raise them, and breathe out, release them. Breathe in to raise, breathe out to release. And last time. So holding our shoulder blades down our back, we'll float our arms so that they are pretty much level to our shoulder joints, and then it'll be shoulder blades together, shoulder blades apart. I'll turn my back. So we'll go shoulder blades together as we retract, shoulder blades apart as we extend. Shoulder blades together, shoulder blades apart. Shoulder blades together, shoulder blades apart. Shoulder blades together, shoulder blades apart. And last one. Now, as well as retracting the shoulder blades, we can also retract the chin. And this is a movement similar to pulling a book off a bookshelf. So if you imagine that your chin's a book and you're pulling the book off the bookshelf, the head moves backwards, the cervical vertebra come into better alignment, and we gently draw it back. It's not the most attractive exercise from front on because it gives us all a lovely double chin. However, it is a really, really nice exercise to learn for aligning the back of your neck. And it's also really important when we are in 4 points and we're trying to hold neutral in 4 points. When we get tired, what tends to happen is our head tends to fall forwards into protraction. If we can practice a chin retraction when we are kneeling, then we can actually put that to the 4-point position, and that will help us to maintain better alignment when we're in 4-point kneeling, okay? And that's what we'll do next. So I would like you to come over onto your hands and your knees. So you're in 4 points, hands under shoulders, knees underneath hips. Our visualization for neutral is either a straight line from the crown of the head to the tip of the tailbone, or that we're trying to balance a plank of wood along the back of the body, and that plank of wood should touch at the back of the skull between the shoulder blades and the sacrum. So there's a little hollow in your lower back and there's a gentle curve in your neck, okay? And it's a curve in the neck we want to be really careful of, making sure it doesn't go to a massive curve like this where we drop it forwards into protraction. So that's where our retraction comes in. Holding our 4-point kneeling position, we're going to engage our deep pelvic floor and our transverse abdominals, and we're going to hold those muscle groups in while we hold our position. We'll do that for the count of 10, 9, 8. Now I'll show you in a moment the alternate exercise to practice if you find that weight bearing through your hands or kneeling is not a good position for you to be in. So with the last 3, last 2, last 1, and then we'll release the core muscles. Now we're going to do that again. So if you're okay staying on hands and knees to practice that again, please do so. If kneeling or weight bearing through your wrists doesn't work for you, please lie down on your tummy. Now you've got feedback here of the abdominal wall away from the mat. Place your head onto your hands, and then you can engage your deep pelvic floor and your transverse. So you're performing abdominal hollowing, but in your prone lying position, lying on your tummy. We're holding our core in for the count of 10, 9, 8, 7, 6, 5, 4, 3, 2, 1 before releasing. We'll go for a third and final round, so either in your prone lying position or as we originally set up, abdominal hollowing, spine in neutral in 4-point kneeling. We'll engage our core, holding 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1 before releasing. Now we are all going to lie down for the breaststroke prep sequence. Place the small pads underneath your forehead to maintain a neutral neck. Arms wide in a W position and core muscles engaged. As we exhale, we slide our shoulder blades down our back. Inhale, peel the face and chest away from the mat. Exhale, release the chest and the face down to the mat. Inhale, release the shoulder girdle towards the ears. Exhale, slide the shoulder blades down the back. Inhale, peel the face and chest away from the mat. Exhale, release the chest and face back down to the mat. Inhale, release the shoulder girdle. Exhale, slide the shoulder blades. Inhale, peel the face and chest. Exhale, release the chest and face. Inhale, release the shoulder girdle. Exhale, slide the shoulder blades. Inhale, peel the face and chest. Exhale, release the chest and face. Inhale, release the shoulder girdle. Twice more through prep. 1. So we're practicing depression of the shoulder girdle, followed by cervical thoracic extension. And it will feel like we are lifting our breastbone up. We're going to follow this with a little bit of work for our scapula. We're doing scapular retraction. We will keep our head down, raise the arms and lower the arms. And as we raise the arms, our shoulder blades will move closer towards each other. So try to make sure that your hands and your elbows stay on a straight line to each other when you do this, and you don't just lift your elbows up and release your elbows down. You won't get the right movement if you're just lifting your elbows. So the whole of the arm, raising and lowering, squeezing the shoulder blades together, separating apart, squeezing together, separating apart, squeezing together, separating apart, squeezing together, separating apart. Now we'll squeeze and hold. We're going to hold the arms in the air for the count of 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Release the arms down. Okay, hip extensions. If you're more comfortable having your hands underneath your forehead for this one, please just pop your hands forwards. We want to tighten the buttock, tighten the thigh. That's going to lift part of the kneecap away from the mat, and then just float the leg gently off the mat before releasing down. Change legs, tightening the buttock, tightening the thigh, and float. Releasing down. Stay slow, stay controlled, going through the sequence of tightening the buttock, tightening the thigh, float and hold. So at this point, the muscles in the legs are beautifully contracted statically and you're working quite hard, releasing down. Tighten the buttock, tighten the thigh, float and hold. Releasing down. Tighten the buttock, tighten the thigh, float and hold. Now again, if you find the float and hold is a little bit too much, there is absolutely no reason why you can't tighten buttock, tighten thigh, and hold the muscles statically contracted without the float off the floor. So we'll tighten buttock, tighten thigh, option to float, hold, releasing down. Tighten buttock, tighten thigh, option to float, hold, releasing down. Tighten buttock, tighten thigh, option to float and hold. This exercise can sometimes pull up some muscle imbalances. If you find you're not able to lift the legs straight off the floor, and if you find that once you tighten the buttock, tighten the thigh and try and lift your knee bends before your leg comes off the floor, that can show that you've got dominant hamstrings, so that the hamstrings are very overactive and they're trying to do the work of the buttocks to bring the leg into hip extension. It's important that we don't encourage incorrect movement patterns. If you do find that when you're lifting the leg you're getting your knee bending and there's nothing that you can actually do to stop the knee bending when you're lifting up, then stay with the buttock and the thigh tightening. Please do not try to lift your leg up. Give it a few weeks of doing the buttock and the thigh tightening. Then have a go once you've built some underlying kind of static strength into the buttock and the thigh. If you then find that you can lift the leg and keep the knee straight, continue to do so. However, if you can't, you're going to need just a little bit more time to spend with the static contraction of the buttock and the thigh. We'll go one more to each side. Last time, buttock and thigh, option to float, releasing down. Stage 2 of breaststroke preps brings us into hands by hips position. We perform a scapular retraction, squeezing the shoulder blades towards each other, but then we also get rotation into the arms, and we do that by turning our elbows and palms in tight to the body. We follow that with a float into the lower back, a very, very discreet float, so that you can just feel a very, very gentle change into the degree of curve in your lower back. We'll release the lower back and release the shoulder girdle. So we squeeze the shoulder blades, rotate the arms in, very, very discreet float. I want you to think about reaching your hands down towards your knees. Release and relax. So what we don't want to see with this is arms doing this, back doing this, because there are global muscles. With Pilates, we're trying to target the muscles that are very, very deep and very, very close to the shoulder joint with this one, and the lumbar spine with this one. Exhale, shoulder blade, shoulder joint. Inhale, lower curve. Release that lumbar curve, release the shoulder joint. Go again, shoulder blade, shoulder joint. Lumbar curve, float. Release the lumbar curve, release the shoulder girdle, and last time, shoulder blade, shoulder joint, lumbar curve, float. Releasing the lumbar curve, releasing the shoulder girdle. We'll stretch that one out with shell. If you're happy to go into deep knee and hip flexion, our shell stretch is here.
If you need to modify for sore shoulders, your hands go here by your heels.
If your hips and your knees are not comfortable with such a degree of flexion, to get your spine flexion, you may decide to sit knees apart and just gently flex the spine in a seated but controlled slump stretch position. Okay, releasing from shell stretch or seated slump stretch, we are going to work on our side and we're going to try to do pelvic tilts on our side. I would like you to set yourself up so that your knees poke forwards, but your feet are in line with your pelvis and your pelvis is in line with the back of your head, okay? And again, you're in neutral, so you're right on the arm. You don't have any pressure of your waist against the mat. And then from here, using the rectus abdominal muscles, we're going to tuck the tail between the legs and untuck. Tuck and untuck. Tuck and untuck. It can be tricky when you are trying to practice a move that you already know, but your body is in a different position. So please have a wee bit of patience with yourself if you've just taken yourself to side lying and gone, oh, I can't do this. Go for 2 more repetitions to tuck and untuck, and last one, tuck and untuck. Now, we'll take a stretch into the front of the thigh. If you can reach your foot, please do so. And try that tuck, tail between the legs. It will make a difference to the stretch. It will make it feel a little bit more pronounced. We'll hold for 5, 4, 3, 2, 1, and then we'll release. Okay, the focus of our next exercise will be on our shoulder blades. So a little bit earlier, we did an exercise where we were squeezing shoulder blades together, separating shoulder blades apart. We will be doing exactly that movement, shoulder blades together, shoulder blades apart, but we're going to be weight bearing for it, okay? And we will be in 4-point kneeling, hands under shoulders, knees underneath hips, spine in neutral. From here, we squeeze the shoulder blades together, separate the shoulder blades apart. Squeeze the shoulder blades together, separate apart. If you're happy to continue in that position, please do. However, if you prefer not to kneel, you can also load the shoulder girdle by doing this against the wall. So from a standing position, you would place your hands against the wall, squeeze your shoulder blades together, push into the wall, separate them apart, squeeze them together, separate apart. And the further you stand away from the wall, the harder work you will do. So if you stand quite far away from the wall, obviously you need to bring your hands down and then you rise onto the balls of your feet and you do shoulder blades together, shoulder blades apart. It becomes much tougher in this position because of the incline of the body compared to when the body is more vertically upright. We'll make these our last 2 repetitions and final one. We'll go for side stretch from shell this time. Again, if you are okay with hip and knee flexion, you can come back into your shell, moving to one side for the side stretch. Keep your head in between the arms and you will get a nice stretch down through one arm into the armpit and down into the side of the spine. If kneeling in the shell does not suit you, you can get side stretch either from kneeling or seated by raising one arm and going into a laterally flexed spine position. So please use this as an alternative if it is better for you. We'll hold for 5, 4, 3, 2, 1 before releasing. Now we're going to take the same stretch, going the opposite way. So if you modified it to either a seated or kneeling, you're in a lovely lateral flexion here. Whereas if you are in your shell position, you've now taken that shell stretch into the opposing side, head staying between the arms, arms are extended, and we'll be aware of that stretch down through the arm into the upper back as we hold for 5, 4,
3, 2, 1, and release. Okay, so balancing out that pelvic tilt work, we did it on one side, we need to do it on the opposite side. I'm swinging my heels and my head to opposite sides of the mat. So we're setting up, this mimics lying on our back. So the back of our head, our sacrum and our feet are all in a nice straight line. We are as neutral as we can be, and then we pelvic tilt. We pelvic tilt. We pelvic tilt. We'll do a set of 6 more. Last 3, and 2, and 1. And then we'll use pelvic tilt as part of our quad stretch, holding onto our foot and tucking our tail between our legs, which will deepen the feeling of stretch through the front of our thigh. Holding 4, 3, 2, and 1 before releasing. We're going onto our back to practice the ab prep next. If you do find that you need a small pad underneath your head to help you get a much better neutral position when you're lying on your back, then please do take the chance to use a folded up towel. Likewise, if you find that your knees start to wander in any direction, use something to pop between them, and that will give you a focus to keep your parallel leg position and also give you a little bit of extra inner thigh work. So setting up our ab prep. From our supine lying position, we've got our right angles at the knee, ankles, knee joints, hip joints all on a straight line with each other, pelvis neutral, spine neutral, collarbones long, arms reaching down by the side, and a nice neutral neck. Taking a preparation breath in, we engage our core and rock our head. On the breath out, we raise our head, we raise our shoulder blades, we raise our arms just up off the mat. We only raise high enough that we can still keep our pelvis and our lumbar spine in the neutral position. At the top point of the ab prep, we then take a breath in to stay, and breath out, release down. Breathe in, engage the core and rock the head. Exhale, raise. Now, none of the exercises that you practice should cause you any pain. Breathe in to hold, and breath out to lower down. So there is a difference between your muscles working hard, and you should expect to feel your muscles work hard. And you may actually view that as painful because they do work fairly hard. But we don't want to make any symptoms that you currently manage or have previously managed to flare up. Take a breath in, engage the core, rock the head. Exhale, raise, head, shoulder blades and arms. Inhale, hold, and exhale, lower. Breath in, engage, rock the head. Exhale, raise. Inhale, hold. Exhale, lower. Breath in, engage, rock. Exhale, raise. Inhale, hold. Exhale, lower. We'll go one more time. Breath in to engage the core, rock the head. Exhale, raise. Inhale, hold. And exhale, lower. The aim of our next exercise is to keep our pelvis and our lumbar spine neutral in response to movement of our leg and our arm. Because we're moving our leg, I'm going to get rid of my head pad. I'm also going to slide down the mat a little bit. I'm conscious I don't have a great degree of space over my head. That should just about do it. Okay. So with our pelvis and spine in neutral, we'll engage our core muscles. And then we're going to slide the heel on one leg away as we extend the arm on the opposite side away. Return, switch sides. So when we switch, we are trying to keep our pelvis nice and still. We don't want the pelvis to rock over to one side. So we don't want to feel the pelvis rocking. Likewise, we don't want to feel our rib cage flaring up as the arm goes over the head. So it's this feeling of trying to knit your rib cage together and connect the rib cage to the pelvis. Continue to work at that level if it's the right level for you. If you wish to add a little bit of extra intensity, double the arms up. So it's one heel, both arms. And if you find that that's fairly easy, you can increase the intensity again, both heels and both arms. Really vital that you're holding your neutral and you don't extend out of it. I'm going to go with one heel, both arms, because that is the right level for me right now. Our aim will be one more repetition, evening everything up before releasing. Okay, we're going to do a bit of buttock work next, and we're going to bring our heels a little bit close to our bottom on purpose and find the pelvis in the neutral position. I'm getting rid of my head pad, and I am adding a knee squeezer pad, so I've got something to focus on with the squeeze of the inner thighs. So I've got inner thigh activation already. I'm going to clench my buttocks, raise my pelvis up to the top of the bridge. And then I'm going to hold that for the length of time that it takes me to do a set of 4 arm scissors. So I'm keeping the buttocks clenched. I'm going to reach the arms for 4, 3, 2, 1. Release the arms and release the pelvis down. And then I'm lifting again to the top of the bridge. I'm holding it there, buttocks clenched. 4, 3, 2, 1. Releasing the arms, releasing the pelvis. Go again. Raise, clenching the buttocks to scissor the arms. 4, 3, 2, 1. Release the scissors, release the buttocks. And again, we raise, holding it there. Scissor 4, scissor 3, scissor 2, scissor 1. Release the arms. Release the buttocks 2 more times through. Raise and scissor. 4, 3, 2, 1. Release the arms, release the buttocks. Last time. Raise and scissor. 4, 3, 2, 1. Release the arms, release the buttocks, release the pad, and go for full body stretch. Scissors will be the aim of the next exercise, and we'll take it as a side lying leg scissor exercise. So this will challenge the strength of our core muscles, because we're going to need to be strong enough to lift both of our legs in the air. Support your head. So we're side lying in neutral but in a straight position with our arms crossed over. You can modify this by placing one hand down on the mat, so you have got a point to push against if you need to. However, if you can work from here to raise the legs and lower the legs, then please do. Keep the gap between the waist. The aim is not to lift your legs as high as you physically can. It is to lift the legs so that you're loading your core in a neutral position. If this feels too severe, top leg only please throughout the exercise. So we'll do another couple of lifts, and then on the last one we're going to hold the legs in the raised position, and it's from here that we're going to scissor. So one leg goes forwards, one leg goes back for the count of 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Bring the legs together and release them down. So if you're working one leg, it will have just been your top leg that will have been moving into your scissor, and you will have to stabilise through your core to stop yourself rolling forwards and backwards with your upper body. So even if you are modifying down, you will still get a good amount of work into the core. We're going to take it into our lying on our tummy position. for Cobra. Cobra takes us into an extended position. For a lot of us, extension is a really important thing because we don't get enough of it in our everyday life. However, if you do have a step deformity, it's called spondylolisthesis, then it's important that you don't extend your spine, okay? So you will know if you have this condition because you'll have been x-rayed and it will have been diagnosed and you will have been told to avoid extension. Feet are as wide as the edges of the mat and our hands are in front of our shoulders. And we're pushing up, elbows, releasing down. Let's do a few range of movement. Pushing up, elbows, releasing down. Pushing up to elbows, releasing down. Okay, no release on this one. Can we stay propped up on our elbows? I would like you to press your hands, your forearms into the mat at the same time as pushing the crown of your head up towards the ceiling. So your arms are working fairly hard here. Cobra is a passive movement and it does bring the spine into a position that our muscles may not be able to lift it into of their own accord. Okay, let's release down from there. And then I want us to balance out our side lying exercise, our double leg raise and our scissors on our side. Just for ease, I'm going to turn my back to you. So I've got my pad ready to pop my head under. And you might find that you can see a better alignment of neutral from the back. Sometimes it's a little bit clearer as to exactly what's going on with the waist. Remember to modify this down. It will be top leg to raise and lower only, and top leg to work your scissors backwards and forwards when we get to that point. Preparation breath in, engaging our core, breath out to rise and lower. Set of 10. Rise and lower. Trying to keep the neck and the shoulders relaxed. Rise and lower. Rise and lower. 6 more. Lift 6. Lower. Lift 5. Lower. Lift 4. Lower. Lift 3. Lift 2. And on the last one we hold. And here's our scissors. Legs split. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Bring the legs to centre, glue them together, and then rest them back down. Lovely work. We're going to end with a stretch, turning onto our back. Bringing pelvis to neutral, one ankle onto the opposite knee, and stretching the hip rotators with our figure of 4 stretch. The stretch we'll feel into the buttock and round into the outside of the hip itself. And I do want you to try to keep your neutral position with your pelvis and your spine when you're stretching your hip. We'll hold it 8, 7, 6, 5, 4, 3, 2 and 1. Release down and change over. So notice the pelvis, especially when you pop your ankle up onto your knee, it can roll over to the side. If that happens, do your best to correct it. Get as close to your neutral as you physically can before raising and holding. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and releasing. Rotational stretch. You'll take one leg straight and the other leg to tabletop. The arms are spread out with our palms facing up towards the ceiling. The bent knee will rotate across to the opposite side of the body. So the pelvis lifts and twists. We turn our head to look away from the knee that's gone over. And that brings a lovely rotational torque through the spine. We may feel stretch into the front of the shoulder into the spine and also into the hip. We'll hold it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Before releasing and changing over. So we're looking away from the knee that's rotated over. We're allowing gravity to act here with the stretch. So it's trying to pull the knee down at the same time as trying to pull this shoulder blade down towards the floor. Holding. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Releasing. Okay, next one we're going to stretch is the outside of the hips again, okay? Keep one leg straight, bend the opposite leg, and then step that foot across to the opposite side. You're going to reach for the outside of your knee and pull the knee over. So you're creating space here. You're going to feel the stretch into the hip. We'll hold 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then we release. We'll reverse it. So lots of hip stretches, but because the angle of the femur, of the thigh bone, is in slightly different places, we cross it and we pull it in, then it gets different fibres of the muscles that run around the hip. Holding. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Releasing. Lengthen to full body stretch, legs down the mat, arms extended overhead. Go into a flat back position if you find that you can get into full body stretch without feeling a stretch. If you go to full body stretch and you can't get your arms onto the floor, there's a couple of options. You can either use some blocks to support your arms, rest your arms onto the blocks. Can be a little bit of a faff. The other thing is to have the arms wider. So have them in a position where they are still on the floor. They haven't got to the point where they're coming off the floor. And hold them there. Over time, you'd be working towards narrowing that distance down. Okay, releasing. Now we'll do a short abductor stretch, but laying on our back. And we can do that feet together, knees apart. If you've had enough of being in your supine lying position, you can also do this as a seated stretch, which we have done loads of times. So please feel free to change your position to seated. Do your butterfly stretch in seated as an alternative. We'll hold 5, 4, 3, 2, 1, and then release. Now those of us who are still on our backs will come to seated to join those of you who do go to seated. We will do long abductor stretch. This is a toughie. This can help to actually sit on something hard. So if you do find that you've got a hard block to sit on or a great big hardback book, then please use that. Try to be as upright as you can. So ideally, if you were sat against a wall, I just happen to have a wall here, you should be able to get your sacrum, your shoulder girdle and your head against the wall as you sat in your long abductor stretch. So if you do have a wall handy, shuffle yourself to the wall, see how close you are, and then notice which bits for you just aren't touching the wall. A lot of the time it can be our head that we have difficulty drawing back into chin retraction to get that on the wall. So if you sat there, your head's not quite on the wall, try your chin retraction, see if that gets it closer. Try to have your shoulders back and down as well, because if your shoulders are rounded forwards, then that will also make it really hard when you try to pull back into chin retraction to get your head there. So if you do pull this back and down, lift the chest up and then do the chin retraction, those two movement combinations should make it a little bit easier for you to get that 3 points of contact against the wall. Okay, let's release it from there. We'll make our way to standing next. You can either use a step up to lunge, which is quite a functional movement to get ourselves to standing, where you put your best foot forwards, tuck your toes on your back leg and step up to lunge. You can also do that with your non-preferred leg as well, just to give yourself a little bit of a challenge. If that doesn't work for you, you might want to try a cross-legged lift to lunge or even a down dog to get yourself up to your standing position. And once we're standing, if we just give the shoulders a nice mobilisation, we'll finish with a little bit of extension. So breathing in, hands are up, and I want you just to gaze up towards your hands. Notice how the spine extends as you're gazing up towards your hands. And release down. Great work. I hope you've enjoyed November's. A lot of pelvic floor focus, because our pelvic floor muscles are very, very important, and sometimes we neglect them.